I know that our finance department did calculations of the cost of our space.
Have you seen those at all?
No, it wasn't part of my job to see those.
Okay. Other than the consenting of the time, strike that, other than the time it would have taken a medical assistant to consent a patient to donate fetal tissue, and other than incremental cost of the use of the space at a PPMM facility for tissue collection purposes, are there any other costs you can identify associated with the tissue procurement process that would have not been costs that PPMM would have already been incurring as part of their regular practices?
Objection. Vague, compound, calls for speculation.
Well, there was their use of our equipment, such as a microscope and supplies that they would use, and there's always overhead cost to everything that's done, and I don't believe you can't discount that and just say that it would have already been paid. It's part of the cost of providing any service.
Okay. Do you know what supplies would have been actually used by any TPOs as part of their work collecting tissues?
Objection. Calls for speculation. Asked and answered.
I did not observe the process, but I could imagine that they would be using gloves and 4x4s and cleaning fluids and
Do you know if any of the TPOs brought their own supplies with them?
Objection. Calls for speculation. Vague, compound.
I do not know. I do not imagine that they did, but I don't know.
Do you know if the types of costs that are allowed to be included by PPMM were specified in any statutes that dealt with fetal tissue collection practices?
Objection. Calls for legal conclusion. Calls for speculation. Vague.
I do believe that there are specific, within the regulations, they list the reasonable costs.
Okay. Do you know if the reasonable costs that are listed within the regulations include fixed overhead components such as staff time?
Objection. Calls for legal conclusion. Vague.
I do not know.
Okay. We'll look at some of those as we go along. Again, though, PPMM would only be reimbursed if a sample was actually usable. Is that correct?
Yes.
So would it have been in PPM's best interest in seeking to recoup its costs if it were trying to maximize the number of usable samples?
Objection. Vague. Calls for speculation.
In our mission to support medical research, it would be, we would have liked to provide usable samples to further medical research.
And it's only by furnishing usable samples would you have your costs reimbursed, correct?
Objection. Asked and answered. Vague.
That is correct.
Thank you, Doctor.